Hi, I'm Dr. Paul Salinas from Park Avenue Spine.
And I'm Liz Barnett, fitness coach from LizBarnett.com.
And today, Liz and I are going to be discussing a condition called runner's knee, otherwise known as patellofemoral pain syndrome, which is characterized by pain in and around the kneecap or behind the kneecap, and is often associated with conditions such as iliotibial band syndrome or patella tendonitis.
Runner's knee is often experienced by individuals who participate in high-volume aerobic activity, such as running, cycling, and group fitness classes. Today, Dr. Salinas and I are going to demonstrate 3 exercises that may help prevent runner's knee. The very first exercise we're going to do today that may help prevent runner's knee is called self-myofascial release. This is actually something great to do over your entire body, but today we're going to focus along the IT band track. The IT band is a fibrous band of connective tissue that runs from your hip to your knee, and when it gets tight, adhesions or knots can form, and those knots can restrict your range of motion, which will be affected when you do things like run or cycle or anything that's a repetitive movement. So you're going to take a foam roller and you're going to lie perpendicular against the foam roller at the very bottom of your hip, the top of your leg, and you're going to slowly roll down the length of your leg, stopping above the knee. You want to make sure you're on muscle or tissue, not on any bone. As you do this, make sure you breathe deeply and support yourself with your bottom forearm across the floor. You're going to do this maybe 3 times up and down the side of your leg, and stopping at any tender points that you may find. Take a few deep breaths there to help release the knots, and then do this on the other side before continuing to the next exercise. The second exercise we're going to demonstrate today is the lateral band walk. What you'll need is one of these mini bands that you can, again, find at your gym or sporting goods store, or you can take a resistance band and tie a knot around it. You're going to take the band about halfway up your leg until when you take your feet hip distance apart, you feel some resistance. What's going to happen is your knees are going to want to buckle in. You're going to use the outer hip muscles to press the knees out so that you stay parallel. Core is nice and tight. You're going to take a few steps to the right, making sure that your feet never come together all the way, and then take a few steps to the left. Take maybe 15 to 20 steps depending on how much room you have. I don't have very much room here, but you're going to keep resistance both on the leg that's moving out and the leg that's coming in. You're not going to let the leg snap back in. Again, this is going to activate your outer hip muscles, your glute medius, which is very important if you're doing a forward action repetitively. Our third and final exercise that may help prevent runner's knee is the double ball wall squat. You're going to need a small playground ball or a medicine ball that will fit between your knees, and you're also going to need a physio ball or a Swiss ball, maybe 45 to 55 centimeters. You just want to put it behind the small of your back, right above the bottom of your pelvis, and you're going to press it against a wall. This is your starting position. Walk your feet a little bit forward. Hands can be relaxed at your side or hands at your hips. What you're going to do now is descend into a squat. Almost feel your pelvis drop slightly below the ball, and then exhale as you come up. As you continue to do this, you're going to feel your inner thigh squeeze the ball between your knees. This is going to activate your VML, which is again very important to keep your knees stable. As you do this, keep your chest high, shoulders back, and try to drop at least to 90 degrees. I'm going to come a little closer and show you what it looks like from the side. So for your double ball wall squat setup, so you can see from the side, my feet are parallel and facing forward, my shoulders are back, and you see the balls at the small of my back. Hands can go actually in front if you need a little bit of stability. You're going to drop your hips down until you reach about 90 degrees or lower, and then press your heels down to stand back up. Again, chest is high, exhale navel to spine in toward the ball. You're going to do maybe 10 to 15 repetitions of this, 2 to 3 sets. As you exhale, come up, squeeze the ball, and as you inhale, come down, drop your hips. The 3 exercises we reviewed today are a great supplement to anyone's existing workout routine and may help prevent conditions such as runner's knee.
However, if you're already experiencing knee pain, these exercises should not replace visiting your medical professional to find out more about why you're experiencing these conditions in the first place.